answering this is Luke.
New hospitals are fantastic, but imaginary hospitals are not. We've been promised investment at the new hospital in Sutton. In fact, Paul Scully's website still boasts that it will be open by 2025. Another failure of this Conservative government and another failure of our Conservative MP to provide what we need in Sutton. We had funding confirmed for a new St Helier hospital in, I think it was 2014. There's a picture doing the rounds on one of our local local WhatsApp groups of a giant sign on the front of St Helier Hospital saying the governor's promised this money, but it hasn't been delivered. The hospital site at Sutton has been cleared, but there's no planning application, there's no consultation with the local council about transport upgrades, there is no commitment, and there has been for the 9 years that our Tory MP has promised it. We have been let down time and time again by the Tories in Sutton on our local healthcare needs. All of this time, St Helier crumbles. We've been promised £250 million to upgrade the hospital at St Helier. That hasn't been delivered. We have a chance this Thursday to change our representation here in Sutton and Cheam. You can elect a Liberal Democrat who will stand up for our local healthcare, or you can choose a Conservative who will continue to fail to deliver what we need in Sutton and Cheam. The choice is yours. Thank you.
Thank you very much, Tom. Thank you very much,
Luke.
So it comes from reading and speaking at the same time. Thank you, Luke. Tom.
Thank you, Luke. If you did your due diligence on Dave Campanelli, like he's on the NHS, you might not find yourself in the position you're in. So, the NHS in Sutton. There's a lot of scare stories going around, and they come from the party at the far end. The fact of the matter is, the Conservatives have got £500 million to build a new hospital. £500 million to build a new hospital.
And let him speak, Luke.
Thank you. £500 million to build a new hospital, Luke. And these aren't our plans. When he says the Conservatives have let Sutton down with the healthcare plans, these aren't our plans. These are the plans of the NHS. My dad was a doctor, and he always used to say, trust the physicians. They know what they're talking about, not the politicians. That's what we're doing. We're listening and we're working with the NHS. We're not working against the NHS. We've got the money. We need to get those plans in, and rather than put motions through council, Luke, telling the NHS that they don't know what they're talking about, let's support them, let's come together and let's get the hospital built.
Thank you. Thank you very much. Tracy.
The Green Party, and I, unsurprisingly, would pay staff fairly, so that we're not, we're in the middle of junior doctor strike, again. We need to avoid strikes, we need to stop the brain drain. There's a horrific statistic of something like 80% of NHS staff, when in the first 5 years of being qualified, leave to go overseas. That needs to stop. We also need to stop going to other countries, especially developing countries in the global south, and taking their best, brightest and talented and newly qualified doctors, nurses, midwives and so on. This is an NHS crisis that's been going on for decades. About 12, 13 years ago, I was involved in the predecessor to Health Watch, and I sat on the scrutiny subcommittee for adult health, housing and social care. There was a drastic shortage of midwives then, it's got even worse since. The Greens would fund the NHS adequately by increasing the taxes on the super rich, which I can go into, but again, it's all in our manifesto. We'd start with an extra $8 billion a year, rising to $28 billion by 2030. Healthcare needs to be a vocation to be proud of. We need to attract more people into it, not taking those from other healthcare systems overseas. And it should be something we're proud of. It featured in the Olympics 12 years ago. Let's make it something to be proud of again.
Thank you very much, Tracy. Krishni.
The NHS was founded by the Labour Party after the Second World War. And when Labour was in government the last time, the NHS satisfaction levels were at its highest ever. Over the last 14 years, it's now come down and it's at its lowest ever, not to mention waiting lists. People going to A&E, waiting 4 hours, GP appointments that scramble at 8 a.m. in the morning. And the Labour Party has a plan to fix that. They have previously fixed it and done the best that they could, and they will continue to do that when they are hopefully in power after next week. And with regards to Sutton and Cheam, Labour has promised that if they win the election, they will rebuild St Helier and they will also rebuild Epsom. That's a promise that's been made. And if you have a Labour MP here in Sutton and Cheam, with hopefully Labour government in Westminster, I, as your Labour MP, will be able to push forward for that and to make sure that that promise is delivered as soon as possible for our residents here in Sutton and Cheam. Thank you.
Thank you so much. Thank you very much for your answers. I want to develop the idea a little bit further. That started off as a question. Oh, sorry, of course. Do you know, that's very, very silly of me. You're quite right. Kingsley, I'm terribly sorry.
It's okay, don't worry. Right, we're going to have to go back in time here. Imaginary hospitals, yes. Queen Mary's Hospital, Carshall.